And this is February 15, 24. That's when you hurt your back.
Yes, sir.
What happened exactly?
Just getting out the bed.
Oh, just getting out of the bed.
Just
So
getting
nothing traumatic.
No.
Okay.
And it just escalates over the days.
And is this something that's been happening like
Yeah, for about 12 years.
for about 12 years?
Yeah.
So this is the newest one. And is this the worst, one of the worst ones, or?
No, I've actually had my back lock up on me about 2-3 times. I couldn't get out the bed at all.
Oh boy. So for the past 12 years, back and forth, you've been locking your back up where it's been almost impossible to walk. You're leaning forward, I see, and sideways, right?
Yes, sir.
All right. Let's start by taking some x-rays and see what they look like. So we'll go over to this room.
Okay.
And you can follow.
Oh.
So you can't go backwards, right? You're just stuck in flexion.
Yeah, it hurts.
All right.
It hurts more and more. And then it's like all down here now.
Okay, so let's stand right here. Put your hands up here and just get as close as you can to this board. So we'll take the x-ray the way you are. I don't want you to go straight. So step forward a little bit. So right around here. I think that's as close as we can get. And don't move. Okay, let's go back to the other room. I got the x-rays.
Okay.
And I'm gonna have you sit here facing that way.
Okay.
All right, so I'm gonna scan your spine to see what kind of pressure we have. Right here at L5. And is that where you feel it originate from?
And it's all across from the bottom.
And it goes all across, right? Does it go to the back of the leg at all?
It goes from the side, by the hip. and
So
down.
right in here?
Mhm.
So it goes into the hip joint and to the side of the leg
Yes, sir.
to the knee.
Yes, sir.
And how about this part?
Sometimes.
Sometimes you feel it here.
Yeah, all the way down from the back.
And how about your leg?
My leg?
Yeah, like this part of the leg, outer part.
No.
So it stops here.
Yes, sir.
Okay. One more reading. Checking for that L1. Right there. All right, so let's see if I can have you on this table, face down.
Okay.
If I need to modify it, I will. I want to palpate and feel your bones on this table. How tall are you?
6 feet.
Okay. So stand over here, put your face in there. I'm going to bring this up, making it a little easier on your hips. That should be easier. Go ahead, put your face. Alina, give me a tissue. I got it. Sweet. Put your face in there. All right, so this is going to go down slowly. Here we go. Don't get scared.
Oh.
Okay, tell me which bone is tender.
Right there.
So this one is tender. How about this one? Not too bad? How about this one? Not too bad. How about this one? And this one. Okay, so L1 is pretty tender and L5 is pretty tender. L5 goes to the back, L1 goes to the side. All right, let's bring you up. so just go ahead and make yourself comfortable on the seat. You can sit there or on the chair. I'm going to study your x-rays a little bit.
Okay.
So we have pressure at L1 and L5. Let's see what we got. While you're sitting, is it easier to lean to that left side?
Yes, sir.
Okay, that right side is pretty
Pretty
tense. Okay, so I'm going to, yeah, because you are shifted more to the left side, okay, and the wedge seems to be more right here at L5 on the right side, and you can see the gap here is less than the gap on this side. So I'm going to close the wedge at L5 on the right side by you leaning on your side facing me. So let's see if you can do this from the side posture. Put your head on the pillow and face me. Lower leg is straight. You got something in that pocket? The other pocket?
Oh, yeah.
Yeah, so I don't want to jam that against your hip.
It's just cigarettes.
There we go. So it's not rough on your hip right now? Okay, what's in that pocket? Because I'm going to put pressure on you.
That's okay.
All right. All right. So Joe, if you try to tense up, I'm not going to go too far, but it's not going to work. So you got to be more like Jello, okay?
Okay.
You're doing a good job. Now don't feel like you're going to fall. I'm going to bring you over to the edge of the table. That moved pretty good. All right, so let's let that settle. I'm going to help you up. Let's see if it's easier for you to stand up a little more straight. So use your knees to get up, put your hands there and push yourself up. Okay, and go a little bit further. Okay, so I think now I can actually put you on this table to do the other one, which is your L1. Can you go back a little bit more? Because I gotta get you back there. Okay, I think we can do it. I think we can do it. All right, so next I'm gonna set your L1 right here face down. Put your face in here. I think this should be a little bit easier. So let's count. We got 5, 4, 3, 2, 1. All right, I'm going to give it a push here, nice and loose. Here we go. Whoa, that was a big movement. I'm going to take the pressure off. We'll bring this down. Now I'm going to bring it up. All right, boss, let's have you walk towards me to this one. Now we're smiling.
All right, yeah.
Okay, so let's go back on the chair and rescan and see what we got. So you got a couple of segments in your back, hot spots, that have been stuck for a long time. Now, on a normal good day, you still have a little bit of pain, don't you?
Yes, sir.
So this is not always like, you know, it's never been like where you're in no pain. There's always a little bit of pain. So now that L1 is clear, it's not there anymore, and that 5 is not there either. So we're gonna leave this alone, leave that alone, and let your body do the rest of the work. So conclusion is, go ahead and stand up. I think you can stand up easier. Way easier.
Yeah.
So look at your back, right? When we see this x-ray, you were walking like this, right? Leaning forward, because the disc was open in the back, just wedging this way. So you need to have a better posture, and when you feel like something's not good, there's pain, there's discomfort, there's limited range of motion, that's when I gotta get in there and do some work. This is definitely fixable. You don't have to live this for the rest of your life.
I hope, that sounds good.
Yeah, but you just have to be a little bit more mindful with your posture. So when you're sitting, you should be sitting more like upright, rather than, see, you're not shifted right now.
Yeah.
And not like this. You gotta arch your back. All right, see if it's easier to sit without you leaning sideways. Putting a little bit more pressure on that right side.
Yeah, it's still a little.
Right. But you were like this.
I was leaning like this.
You had, but to be able to go, you know, to a certain extent, because that inflammation will go down over the next couple of days. I want you to ice it and keep that posture straight. The most important thing is the next 7 days. If you do this, it's going to go bad again.
Yeah.
So I want you to keep it for the next 7 days at least. Feel like your back is in a brace.
Yeah.
And just keep it straight. Keep it arched. Look straight. And next time I see you, I'm also going to adjust your neck, because we can see your head is also forward from that posture. So we'll do some work also down here. It'll be too much for you today.
Okay.
I think I'm going to leave it at those 2 adjustments. You're going to do fine.
Okay.
You'll have a much better weekend.
Right.
Okay. Now, do you have any questions for me?
No, just like it's still a little pain, so that'll go away.
Oh yeah.
Okay.
Oh, yeah. I mean,
Okay.
you know, that the inflammation there was way too much.
Yeah. That's what as you can see, I had the cup thing, and they said the same thing.
Yeah, the cupping is good, but it doesn't fix the problem. So Moore's is more structural.
Yeah, it didn't do anything.
See, L5 is down here, and L1 is the one that actually goes down to the side.
Yeah.
See, I did both of those for you today.
Yeah.
We had 2 spots. Usually it's just 1.
Right.
Yours was like 2.
Yeah.
All right. So if you don't have questions, we'll leave this alone. We'll follow up in about a week or so for second follow-up, because I think I need to do it probably 1 more time. But it's not something that I got to do 10 times.
Right.
But in your case, since it's really sore and it's still a little soreness, we'll do another follow-up. If you can't come back in a week, that's okay. If you come back in 2 weeks. I'm here every other Saturday.
Okay.
All right.
Yeah, 'cause I work, my off days are normally Friday, Saturday, but next week I'll be at work Friday, so maybe.
Yeah, I mean, I'm here Monday, Wednesday, Friday, every other Saturday, whatever that works. But again, I think at this point you're good. You don't have to worry about it. Just don't lose the adjustment.
Yes, sir.
Keep that thing straight.
Yes, sir.
Like today at dinner table, don't do this. You're gonna sit in your car today, just put something in your back, maybe a jacket, fold it up, just make it straight.
Okay.
All right, boss.
Thank you.
Awesome, Joe.
Appreciate it.
Nice to meet you.
Man, that feels good.